Have you ever wondered why two common skin conditions, both causing red, itchy patches, seem to behave so differently at their core? It turns out that while both psoriasis and eczema involve inflammation, the immune system orchestrates a remarkably distinct response in each. The most significant difference in immune activity between psoriasis and eczema lies in the specific immune pathways and cells primarily involved. Psoriasis is predominantly an autoimmune condition driven by the T helper 17 pathway, causing an overproduction of skin cells, while eczema is generally characterized by a type 2 inflammatory response, often linked to allergens and a compromised skin barrier. In psoriasis, your immune system mistakenly identifies healthy skin cells as a threat. Specialized white blood cells called T cells, particularly T helper 17 cells, become overactive, releasing inflammatory signals like cytokines. These signals dramatically speed up the growth cycle of skin cells, causing them to accumulate rapidly on the surface, forming thick, scaly plaques. This is a systemic, chronic inflammatory process that manifests in the skin. Eczema, on the other hand, frequently starts with a weakened skin barrier, which allows irritants and allergens to easily penetrate the skin. When these foreign substances get through, the immune system responds with a different set of inflammatory cells, predominantly T helper 2 cells, and releases chemicals like immunoglobulin E or IgE. This type 2 inflammation leads to intense itching, redness, and dryness, often seen in response to environmental triggers or genetic predispositions. Understanding these underlying immune differences is incredibly helpful because it directly informs diagnosis and treatment strategies. Knowing whether it is a T cell-driven inflammatory cascade versus a barrier-compromised, allergen-responsive inflammation guides your doctor in choosing the most effective medications and management approaches for your specific condition. This deep dive into immune pathways highlights why treatments for these conditions vary so much. For psoriasis, targeted therapies like biologics aim to block specific inflammatory cytokines, such as interleukin-17 or interleukin-23, effectively slowing down the rapid skin cell turnover. For eczema, treatments often focus on repairing the skin barrier, reducing allergen exposure, and modulating the type 2 immune response with topical steroids or calcineurin inhibitors. This targeted approach is key to achieving relief. Ultimately, recognizing the distinct immune signatures of psoriasis and eczema is vital for effective management. It empowers you and your healthcare team to select treatments that address the specific immune dysfunction, helping to calm your skin and improve your overall quality of life.